The coughing and the spluttering that happens after birth is more often than not because of all the mucus in that first 24 hours or so that needs to come up out of baby, either through their nose or through their mouth, where they have very thick, sticky mucus that comes up. You need to just acknowledge before anything else that the mucus that they bring up in that first 24 hours, when you hear it as a parent, can feel terrifying and incredibly scary when you can just see them holding it in the back of their throat and they're starting to go very bright red. That is the point that we need to intervene and just bring baby up, sometimes tilting them forward, so supporting their head and being able to pat them on their back so that they can really bring up that mucus. So many parents are completely unaware about that mucus after birth, but it is incredibly common, particularly for babies who have been born by cesarean birth, very rapid birth. So if you've very quickly, rapidly gone through labour and birth, had a very quick pushing stage, that baby has just flown out your pelvis. Sometimes again, the baby is very mucousy in those first 24 hours. The reason cesarean birth babies are more likely to have mucus is because their lungs are not squished in the same way, and this is quite similar to a rapid birth where they haven't had as much time to have that compression of their lungs and that decompression inside, so they sometimes hold on more to that mucousy fluid. There are things to help with getting rid of the mucus. So firstly, feeding really regularly. That feeding really helps all of the mucus to be able to actually move through the body a little bit easier. But also, particularly for babies who are being breastfed, that breast milk can sometimes bind to it and help it come up a little bit easier because it makes it a little bit thinner to come up. If it's less thick and viscous, then it's more easily just to be posseted up as opposed to sticking to the back of the throat of the baby. Now, if this does happen to your baby, I don't want you to panic. What I want you to do is pick your baby up so that they are not flat. It's really hard to bring up that mucus when you're flat on your back. So pick them up, pop them over your shoulder, pat their back, rub their back. The other way that you can do it that really helps clear the mucus as well is to tilt them forward slightly. Placing your thumb and finger just on their cheeks and underneath their chin here. Tilting them forward and then patting their back, rubbing, it helps to bring that mucus up, and they will just naturally cough and gag and splutter and bring it up, and it will either stream out their nose or it will come out their mouth in this lovely thick viscousy mucusy stain. Now, it's important to note that very occasionally it can be slightly blood stained, and that's sometimes because the baby has inhaled a bit of blood on the way out through the pelvis or the cesarean birth. But anything that is green of any sort needs a conversation with your midwife, and keep whatever that green is on because they will want to have a look at it to see the shade of green. That mucus should pass within the first 24 hours. And if you're at all concerned, please call your midwives if you're already at home. And if not, if you're in a unit still, press your call bell, get a midwife or a maternity support worker just to come in, and they will just be able to look at your baby, make sure everything's okay, and give you the reassurance that you need.